Good morning, you guys. Look at what my shirt says. I need cough. Even though I did just have it, but I could still do more. Okay. Here we go. This is going to be a video. I'm not sure what it is yet, but we're starting it out with this. So, welcome to the video. Typical morning routine would be scrolling through YouTube videos, going to my own channel, seeing that you guys are freaking awesome, and we are at a whopping 19,180 subscribers, which is like insane. So just thought I would let y'all know that I know that, and that's so exciting and I'm so thankful. But anyways, what's up, you guys? Welcome to the video. If you have never been to my channel before, I am so excited you are here. Please make sure you are subscribed and you give this video a thumbs up for more videos like this. Lets me know you guys like it, lets me know that you guys want to see more. That's honestly how I gauge it. So yeah, today I am going to be talking to you guys about my ICU experience, my ER experience, and my IV experience, my first IV experience. So I kind of want to share those things with you guys separately, so I'm going to kind of do this in like a vlog format. So yeah, I'm super excited. I had a really good experience in all of them but one, so let's find out what that is. Welcome to the video, guys. Okay, so I'm going to talk to you guys first about my ICU experience, because this one was probably, actually, that's not what I meant. I meant my ER experience. This one was probably my favorite one. So I'm going to talk to you guys about that one first. I got to go there last week, and that was from 6 o'clock to 2, so it was an basically 8 hour shift. And I'm going to tell you guys some things that I saw. So basically when I went into the ER, you got to, like, you're basically following any nurse that will allow you to follow. So we only do, like, in my med surg class, I have an ICU rotation, which means I go once, in ER. We go do IVs, and these are all three that I'm talking about, and then we also have a thing called DEU, which is where it's 3 weeks of 12-hour and 6-hour shifts, so you have 2 a week, and I start that in March. So my whole month of March is that, and that's basically, you get to be the nurse on the floor, on the med-surg floor, which is really, really cool. It's your patient and everything, and you work with a nurse, and you basically are a nurse, so it's kind of fun. But the ER experience, ICU, and IV, you basically are following someone. So to talk about the ER experience, I went into it thinking, like, I absolutely never want to do ER. Like, I don't think I'm gonna like this. Like, sorry, that's my pillow. I don't think I'm gonna like this. Like, this isn't gonna be good. But I actually ended up loving it, like, every single second of it. I got in there, and basically nothing was going on at 6 a.m. And then I was thinking, I'm like, oh, this is gonna be really, really boring. Like, nothing's gonna happen. And we got into about 6:45, and then, you know, we had a younger kid come in, and then it was like, it just, like, I don't even know, it was like it hit 7 o'clock and it was like, oh, let's all go to the ER or something. Like, it got so busy, and I'm telling you, I did not sit down from 6 to 2, and this was on a Tuesday morning. And I go to a small school, and I don't really live in a big town right now, but like, I was like, I just like didn't even understand. So basically what I did was, it's like 1 minute you were helping somebody with tonsillitis, and then you were helping somebody who had respiratory acidosis. Like, this isn't exactly what happened, but like, you know what I mean? It was just like one extreme to the next, and it was people who were severe acuity and people who were non-severe acuity. So it was very chaotic and very different. Some pros about the ER that I found is you don't really keep your patient that long, so you don't have to do care plans and stuff. And like, I know that that doesn't sound like it would be a pro, but it is, because that's a lot of extra paperwork for nurses. And basically your role in the ER is to get them in and get them out. You're either admitting them or you're getting them out and, you know, helping them get better. It's not about comfort down there. It's not about like everything being perfect. It's kind of going with whatever happens, happens. And that's kind of what I learned from that experience. I got to do 5 catheters, which is so much more than I've like done. Like, I mean, I've done 5 catheters in my nursing school career, but like, to do them all in an 8-hour shift was wild. The nurses were just like, here, do this, do that. Like, it was awesome. They let me jump in, and you know, I pushed so many meds. It was a great experience for that, because you learn the meds in school and you know like what the basis of them are. Like, if I told you Coumadin, you would know what that was, just the basis of it. But like, when you're actually pushing them, and you have to pay attention to what the dose is and making sure that you're calculating it out right, or the calculation is right itself, and that you don't push it too fast, like, it was just being thrown in, and it was awesome, and I really, really enjoyed it. Some cons that I don't like about the ER that I learned was the fact that people come in there for about anything, and in the US we can't turn people away, so that is something that I feel like would catch up with me if I chose ER. I don't I don't feel like you need to go to the ER if, you know, you are like not dying. Like, I feel like in my personal, and I guess I'm biased because I'm a nursing student, but you shouldn't be going to the ER for some things that people go for, like the non-acute things. And I guess that really, sorry, I'm playing with my hair, it's wet. And that really, I guess, like bugged me. I just like, and I like talk to the nurses and they're like, yeah, you really honestly just get used to it. Like, that's just the way it is. People don't understand that you can take people to urgent care for things. And I guess I was just like, I don't know. It just like annoyed me. But other than that, I did catheters. I helped extubate a patient, helped intubate a patient. What else did I do? And you have people who come in from an ambulance and then you have walk-ins. So there's differences. You have a trauma room, you know, there's just so much going on. And I like the fact that, sorry, this is moving. I like the fact that it would never be the same. Like, no day of work would ever be the same. And that's definitely something that caught my mind, was thinking, you know, what's going to happen today? Is a trauma going to come in, or is nothing going to happen? Is it going to be slow? Like, you just never know. So that was the ER experience. I definitely recommend keeping an open mind, and that was what I didn't have because I was so busy with clinicals. I was like, I'm not gonna like this, but I went in and ended up enjoying it a lot. Like, I loved it. So keep an open mind. I definitely have another position specialty on my radar, and that would be ER. So yeah, that was that experience. Did I trick you guys? Does it look like it's short? There it all is. Okay. Okay, so location experience number two was the ICU. So I went to the ICU, oh my god. So my ICU rotation was 12 hours long, and that was from 7A to 7P. Basically the same type of thing as the ER. It's kind of like shadowing, it's kind of not. We're able to do any skills or anything that the nurses will allow us to do. So in my situation, I got into the ICU and they were fully booked, like everything, every room was taken. And then what I learned was that in the ICU, the goal is to discharge people pretty quickly, unless they are severely, like, you're in the ICU because you're critically ill, like it's critical care. So you're in there for a reason, and if you're not needing critical care, then out the door you go, is kind of what I learned. Not in a bad way, but really though, like, you don't want to be in critical care if you don't need it. Like, I mean, you're in there if you have, you know, an Abg line, so like that is an arterial blood gas line. So those are only in the ICU at my hospital. So basically they take the needle and they go into your artery, and that's how they monitor, like, they're monitoring your ABGs, they're monitoring your blood pressure. That's how they like consistently monitor it. So you have to be in the ICU for that. I didn't know that. What else? Balloon puncture in the ICU. If you're on a ventilator, you're in the ICU. Like, they're able to monitor all of those different things. So it was pretty cool to see all of the different monitors and everything that was going on in the room. There's a lot of things you need to know and be able to take care of. So that was pretty cool. So basically when I walked in, it was kind of low-key, you know, you did rounds, and in the ICU there are specialty rounds that happen. So basically it's the team of healthcare professionals that are caring for that patient in the intensive care unit, which is, you know, a social worker, the different physicians, maybe a physician coordinator. A couple people had social workers. I just said that. They all have social workers, but just dependent. There's a dietitian that comes in, case manager, the nurses, yeah. So basically just like a big giant, there's literally probably 8 to 10 people in the room, and then you add me in there and it's 11, and it's just a lot of people talking to the patient and the family. So you're just kind of going over the plan of care. Every morning this happens, and so going over the plan of care, seeing, you know, how they're doing, what needs to be changed, what's going on. So that kind of happens in the mornings there. You know, they do hourly rounds in the ICU. That's different on like a med-surg floor where it's every 2. They do assessments, obviously. What else? I'm just trying to think of the basis things I can tell you guys that I learned. Anyways, okay, so we'll go into what I saw. I actually got to take out an Abg line, which is that line right here. That is a very severe thing to take out, and I didn't realize that. So I took it out of the patient's arm right here, and I had to hold pressure for 5 minutes. That was cool. That was like one of the first things I did. Transferring patients in the ICU is very terrifying because they have like 70 million things monitoring them, and if you mess something up, like, that's on you, and you need to make sure that you can fix that. So that was kind of frightening, but we did that. What else did I do? I'm trying to think of, like, I have to tell you guys like the bare minimum because of HIPAA, and like obviously I'm not using patients' names or anything, but I still worry about things that I say. So what else did I get to do? I helped extubate a patient. I helped do a midline suction, which is when it's completely like they're extubated, so the tube's down their throat and there's like this little suction catheter that goes through it all the way. And basically this is very uncomfortable for the patient, I'm sure, but at the same time it's nice because you're getting out secretions. So it went all the way down their throat, and then I basically held the suction once I got in and held it like suctioned out and came out, getting secretions out. Worked a lot with ventilators. I took swabs and swabbed out a person's mouth who had a ventilator in, which I'd never done that before. That's terrifying to me because, hello, there's a freaking tube down their throat. But the nurses were awesome in assuring me and stuff like, hey, like that's secure in their mouth, like you're okay, and they need to have their mouth cleaned. So hung a lot of medications, gave a lot of medications. And when I say hung, I mean I haven't had a ton of experience like spiking bags and hooking up. Like this was the first, like the ER was actually the first time I learned, and this is kind of embarrassing, the first time I learned how to do tubing correctly and actually put it in and program the machine. And that's so embarrassing to say like in your 4th semester, but in clinical you really give, like, it depends on where you are, but like I never got to do anything with pumps. I gave, like, have so far given like oral meds, and you know, that's about it. So I learned how the tubing works, where, you know, blue to the shoe and flip it, and it's different at different hospitals, but you know, getting it to go all the way down through the line and clamping the tubing, and it was just like I learned all of these things in these 2 places in, you know, a matter of 20 hours, and it's like, okay, cool. In the ICU, I gave a lot of pain medications. I want to say this, I don't know if I can say this, but anyways, I had a big case. Let's just say that I had a big case come in, and I was helping the nurse, and it was very interesting the fact that this patient was in very, very critical condition, and being there and assessing them was just like with parents looking at you and family members asking you questions, and it's like I stood there and I'm like, I like this. This is what I have studied my whole life for, and that's kind of how I felt in the ER too. It's like those are 2 critical care like sections, and like the feelings that I got from like being able to be a part of it and jump in, like everybody looks at you like this is one of the most vulnerable moments of their life, and they look at you, and you know, I'm sitting there, I'm completely calm, I find this awesome, but it's not awesome for someone else, you know. So that's kind of an interesting part that I found of the ICU and the ER that I never thought I would enjoy, but I really did. Got to watch an NG tube go in and out. That was kind of, I could have probably inserted it myself, but the nurse was like, we were having trouble with it, so she was having to reinsert it and stuff, and listening, you know, taking the little bulb and, you know, like squeezing it to see if you can auscultate and hear bubbles just for placement. That was cool. I have not done that before, and I got to do that. What else did I do? With medications, I hung a lot of like different kinds. So like there were like powders, and like being able to reconstitute things and pull it up in the syringe, and getting used to the needle, and you know, giving injections, and just getting comfortable with giving meds is like such a big thing that you really don't get to do in clinical. And so in these situations, these nurses were great in just pulling me in and saying, hey, do this, can you do this, like do it, like just do it, like not looking at me like I'm 10, looking at me like I already have my license. Like that's how they treated me, and I really appreciated it. I had awesome people who kind of told me everything. Like that's the best thing. If you have a shitty clinical instructor or like preceptor or somebody who's leading you, it kind of ruins the experience for you. But I was like blessed enough to have awesome people like walk me through everything. And then in some situations they just said, you know, hang this bag right now. Like, and I was like, really? Like really? You want me to? Like you want me to hang this fluid? Just super simple, like super simple. But to me and like probably my other classmates, it's like, hold on, you sure you want me to do that? Like that's how I felt, and it was an awesome feeling, and it kind of made me like test my skills a little bit, and it was great. I really appreciated it. So that was my ICU experience. So side note, just randomly decided that I wanted to wave my hair, because in reality I really freaking hate straight hair. Like I think I look stupid with straight hair, so I kind of like waved it. And then the other thing is, you guys have been asking me about is my eyelashes. They are extensions, fam. Like these are not my eyelashes. They're kind of getting a little sparse, but I'm gonna get them done before I go to Cancun. Sorry, you're right up in my face. But yeah, they're done by my friend. I will put her little thing right here. She is amazing. Absolutely love her. She did a great job. So yeah. So now what time is it? It's about 12:15. I'm gonna see if I can get a few things done before I head into class. Sam is in the ER till 2, and I'm gonna bring him lunch, and then we have class at 2:30. So that's the plan. And then Jim, more school, clinical next morning. So I will let you guys know about the IV experience too. For the last little segment, I thought I would come to you guys in my bed because that's just where I'm at. So I'm gonna talk to you. This looks like a really awkward angle. We're gonna make it work. I wanted to talk to you guys about the IV experience now because I had kind of a rowdy experience and I just want to share mine in case this ever happens to any of you. Not that my experience was bad, it was just like a shock for me. I think like probably the most was like the shocking part of it for me. So basically we get to go to a place where you basically are there for 4 hours to start IVs. It's like pre-op, post-op, and you know, the patients are there just for surgery, like outpatient surgery. And it's not like the hospital, it's just like an outpatient facility. So I go or whatever, and you know, I started like a couple IVs in the ER, but like I didn't, like I was so in the moment and adrenaline that like I didn't really have time to sit and like focus and pay attention to what I was doing there. So I kind of posed this as like my first time like starting IVs. Like I really wanted to know like exactly like what I needed to be doing because I really had no idea what I was doing. So I go in and the nurses are great, you know, they're explaining things to me and, you know, talking about how to go into the vein and tricks in the trade and like how to make sure you hit it, how you get flashback, you know, how to push the catheter forward, whatever. Those of you who don't know what I'm talking about, I'm sorry. But anyways, there's a lot of tricks with putting IVs in, and it's a little different everywhere you go because some places will have it where it automatically will stop the blood, some won't. Sometimes you got to keep the needle in there. Anyways, so my very first one, it was on an older gentleman, and older people have, you know, like thinner veins and they might roll around, and I was completely aware of that. And that one went okay. The nurse had to come and kind of help me maneuver the veins because that was my first time like doing it on somebody with really fragile veins, and that wasn't the best time. And then I did it 5 other times. So I'm going to tell you guys about the third one because this one was the experience that I like hope to never have again, but I will because I'm going to be a nurse. Maybe not because I won't do this again as a student, probably. I learned from this, but basically before that I did any of these IVs, the nurses would ask, you know, hey, I have a student, is it okay if I, you know, come in and let them do your IV? I'm gonna be right here. And most of them said yes. Well, one patient misunderstood and I got that IV. That was the one IV of the day out of the 6 I did that I got. I mean, I got all of them, but it took me a second on a couple. Like, it's just getting comfortable with like plying the catheter in and putting a needle in someone's arm. Like it's a lot. And so that was the first one that I literally got on the first time, and she looked at me and I was asking the nurse how to tape it because they tape things differently in different places. Like the hospital tapes it differently in different units, and so I have no idea what I'm doing. So I'm like, you know, like I want to make sure I'm taping it. And the patient looks at me and she's like, you know, I wish you would have said like, hey, I'm learning because needles make me really uncomfortable. And she basically like blew up in my face because I was a student. So I'm not going to go much into more detail, but basically made me feel like I was very inferior, that I shouldn't have been doing it. And I basically wanted to cry in the room. It was a very, very awkward moment. And I think the nurses, like there were 2 nurses in there at that time, and one of them just said, you know, I thought I asked you and you said that was okay. And she's like, no, you just asked me about an IV. And I was like, oh. I was like, you can clarify. But the patient had hearing aids, and you know, it's okay. Like, it's okay. It was kind of an eye-opening experience for me because, you know, I do realize that IVs are a very stressful thing for people when they come into the hospital. So it's just something that I need to remember when I was sitting there, because I did feel very, very awful about myself. I was just like, you know, I'm sorry, but like there was nothing wrong. Like I didn't do anything wrong. I literally got the IV perfectly. And I just thought it was funny that it was that patient. But so I didn't love that experience that day. I didn't really love any of it. I was very stressed because I think it was like, oh, I'm just doing IVs, like I need to do this, I need to do that. And you know, it just wasn't the best experience, but I definitely learned from it. It's definitely something that I can take and move forward with, so I'm thankful for that. I have been in the hospital a few more times and got to start more, and they've gone well every single time. So I think that that was just kind of my knock you right in the face kind of experience, but yeah. Alright guys, well, I hope that you learned something from my 3 experiences. I know that they're kind of boring to talk about, but for anybody who's going into them, that might give you a better idea of what you're getting into. I really did enjoy them, and I really do hope that you all enjoy your experiences, whatever your clinical rotation may be. Get in, get your feet wet, don't stand back, ask the nurses what you can do. I know sometimes it's staring at the clock and wanting to get out of there because you have to study, you have things to do, but try and do everything you possibly can in the 8 to 12 hours that you're there, you know, 4 hours, whatever it may be. You only get an education so many times in your life, and you're very blessed to even be in nursing school. There's so many people who would want your spot. That's something that I try and remind people constantly about school, especially nursing school, is that there's always somebody out there who would take your spot before you would. Somebody that would just take your spot. So just remember that when you're sitting there thinking about getting out, because I have to remind myself. So anyways, thank you guys so much for watching this video. If you loved it, please give this video a thumbs up. It means the world to me. It lets me know that you guys like it. And I will see you guys in the next one. Bye, guys.